Good evening, dear viewers, and welcome to another episode of Health Link, brought to you in the studios of QTV by myself, your host, Dr. Shamila Jah, and my co-host, Dr. Masarinde Njai. So to our viewers, we once again want to wish you a happy Ramadan, and may we all benefit from this blessed month. So the situation with regards to COVID-19 globally continues to evolve, and now we have more than 3 million confirmed cases worldwide. But most importantly, in the African region, we are having now close to 22,000 confirmed cases. And what is even more worrying is that the West African region has 40% of those cases. And this is, getting closer and closer. And we will be discussing very soon with the guests that we have in the studio with us on, what is happening in West Africa, and in particular in Senegal, and what we as a country should be focusing on in this response to COVID-19. So before I go any further, I will hand over to my colleague, Dr. Masarinde Njai, to greet our viewers in both Mandinka and Wolof. Welcome, dear viewers.
Assalamu alaikum badin lamoylalu mbale be kontan nambal bismillah na programme la men keda health linking gamen ke QTV arabo arabala anin dimasunu wala comme ali yalo nyamen kachani watu be abe semberin sasal le ka fo me ko coronavirus waran covid-19 fenne me alon ko be ya kalam to ko ay dunia be batandi bakela ne ajube sambi dunia kono siada fo mo million sabati me alon ko wole nyin coronavirus sodo ni natan africa kono juwe jang bajira ko men siada mo wuli mo nim fulati wala ya soto africa kono jang ni nata jube na nyin tiliji dantangol jam ma fangola jang même west africa ti e bajira ko nasiata nin keme mo tannano be jum ma fangola oto kamala dol mu fenneti mi alon na banko nyi memu gambeti aman siaja nyawnyana ni ban signol men kata senegal ti abe siari wotole oto nalbe kacala ni na luntamba men nata jambi pour analyse kacha coronavirus la kuba nyame ñin dunia kono anin dol mem mu banko de gambia ñanta mu nekala ni ala sonta nal bole kacha la suñ bokki deglu kat yi ñu ngi leena bismillah suñ programme bi moy health link buñ dé def QTV alal bu nekk ak dimanche comme nuñ ko xamé rek programme bi won mun na nekkon nano lo xamné dañ ñoo waxtaan rek ci coronavirus parce que lool mo nekk problème bo xamné aduna bi yépp fuñ nekk ni ñu ngi joyantu ci loolu si kaw loo xam ne si aduna bi léegi lu ëpp ñetti millions nit moo ko am si aduna bi léegi fuñ nekk nii te soo ko xoolee Afrique fii di nga gis ne lu ëpp juróom-ñaari junni nit ñoo ko am si Afrique bi fii te di nga gis ne West Africa mooy suñ sub-Saharan Africa bi soo gisee su nekkee téeméer la ñeneenti fukki yëpp amoon na loo xam ne si West Africa bi la nekk te ñun Gambia duñ mën a toog teg suñ loxo parce que soo ko xoolee suñ kees yi bariwuñ waaye suñ dëkkandoor mooy Sénégal ñoom seen case bi bari na trop so si kaw loolu suñ gan bi mu ngi fii dinañ mën a waxtaan ak yéen si nun war a def pour aar suñ boppa si coronavirus bi jërë nañ jëf.
Thank you so much, Dr. Njai. So our guest today, dear viewers, is Dr. Desta Tirune, our WHO country representative to the Gambia. Welcome, Dr. Desta, again to the program. It's been a while. I know you've been very busy with the COVID-19 response. Welcome, Dr. Desta.
Thank you.
It is concerning what is happening in the West African region. Today we know that 3 countries in the West African region have already registered community transmission, including our neighboring country, Senegal. So we'd like to really hear from you your advice on this for us in the Gambia. What should we do, especially the general public?
Thank you very much, first of all, for inviting me again to this Health Link program. It's very, very important to know what's happening around us. In the Gambia, we have about 10 cases that we reported, and today probably we have also 1 additional case that came across the border also from Senegal. And as you know, our borders with Senegal is very huge, and it cannot be really completely closed. Officially it's closed, but people are crossing the border on a daily basis in numbers. And that's a big threat, because what's happening, as you have rightly indicated, is that the number of cases in Africa is increasing slowly. And Africa is at the beginning of the outbreak still, and but in many countries now, in the past few days, many countries have registered significantly higher numbers that they have ever recorded. That shows us that we are actually approaching to go to the full-blown outbreak in the African continent very soon. And particularly one important thing to note is that our neighboring country, Senegal, which is surrounding us completely, the number of cases has gone very fast in the last 1 week to very huge numbers. And there are only two districts that are not that have not reported a case of COVID-19 in Senegal, which is bordering the Gambia. All the other districts have reported a case, which means that every day people who are crossing from Senegal might probably be infected with COVID-19. So it's very, very important to note that in Gambia, although we have only 10 cases, it does not mean that we are over it, because what we recognize is that as we have very close interaction with Senegal, the population has a very close link, and through even blood-related families across the border, so anybody can really be anytime be having a visitor from across the border that may really result in huge transmission in the Gambia. So we have to be careful. Any person who crosses the border, if you happen to have the community members, please report it to the health authorities with the number 1025.
1025.
Please always remember that you have to report it. If you don't report it, you may be having someone who is infected and may even affect your family. For your own sake and for your community, it's always good to report it. And the number of cases that we saw, 10 does not mean that we are over it. We don't know, because in the Gambia, we have still to expand our testing. And when we expand our testing in the coming 2 weeks, few weeks, we may be seeing much more cases that we are not seeing currently. Currently, our testing is not optimum. We still have a lot of gaps that to address, and the Ministry of Health is trying to address those gaps as soon as possible. And in the coming few weeks, we'll see more cases to come. And it's not the end of it. Please don't relax. Observe all the advices given. Distancing is the most effective strategy.
Yes.
Please keep your distance from anybody outside your family. Keep your distance. A minimum of 3 steps from you. If you keep that always, you will be protected, even if you are not doing anything. Plus the hand washing. These are the 2 effective strategies that you have to really implement. And if you do that, I think you will be able to really help contain the outbreak in the Gambia much more effectively. That's what I would say.
Thank you so much. Dear viewers, we will be opening the lines very, very soon. But before we do that, I'll hand you over to Dr. Massareddine Njie to translate this for our viewers. Thank you so much, Dr. Desta.
Okay, baraka bake na lalu. Comme Dr. Desta wa fo ka nyamen rong be ngamel long wala nyinti ko nyun kuba namen sasa nyin sembo warakan Africa janne sai. Andum banko membe ko Senegal wala yalon kon ton wala be nyobala ila keso be siya kam bakele especially nyin last week ko men tambita teng. So to kammalan tol nyanta mu nekala ka fo kon nga ke mo tan kilina mal so do me nyin soto o martin na kon nyanta mbulula nyokam bawo banko dul tala fo men siya ke kes ke menani ti sainte. So kamala manyina kambulula nyokan ka fo ko abantale hani bawo nabe Senegal don ntol mantanka bawo ne ganet gambe jube baaji la ko momo ni aji jang e balon ko mebi baadi mo sodo Senegal le wala enen kataje wala haaji bi jele baaji la kon ton ni Senegal la ko bebe nyokonon oto kamala ndol tasino la nga fo ko ni Gambia ma sodo abe Senegal ndol tankata hani mantanka oto ni ko membe o nyama nsa katantol be na wajibole banko dingolo bawo na bodal mbe akros le na bodal nyama Gambia Senegal ka bona jere du nyanga diate nyame wato wat oto kamala ndol be semen keno wala banku dingol ka kenna do koti ka kenna wajiboti banku diya kamala kaje ko momo nata nyim banku kan ana botnan Senegal le ro nga kata nga report nga même fo do ni report wala nyindi momo du nday banku kan e nyata tala quarantaine fo lokum fla ni lokum flo bande ye test ni man sasa nyi solo sinebula oto comme abe siya kan Senegal te nyam wala nyindi ko mo jamal bi je se bonan Senegal 5 sasa nyi trena ebe dol jela ba jela ko dol bi jes nanon kono jang ndol ba fla ko fente la bari ni sasal nata dol bi jes bore nang because ba fla ko sasa se kan Senegal le aman si aga me oto mbatanga bari ngata mabo Gambia woto banku dingo bela wajibo le nyinte ni momo ya nata banko ka yakalam to do yalon ka bonnon dulal to me ala muke Gambia ye fero beke ye l'hôpital do kulal la mol kumande wala 1025 ye 1025 kumande police na kamma ya samba quarantine ya jube fa sasa soto fama soto suñ mbokki déglukat yi comme ni nga ko waxee rek docteur Desta mu doon explain pour ñu xam ne léegi fu ñu nekk nii di nga gis ne feebar bi am na doole trop Africa surtout Sénégal te Sénégal mooy suñ dëkkandoor yi fii so da ngaa gis ne Sénégal suñ amee rek ñun suñ amut Sénégal su amee rek fekk ñun moom amaanguñ jaama duñ mën a toog teg suñ loxo ne léegi amut fii parce que soo gis xoolee fii fukka benn case rek lañ am waaye loolu taxul ñu toog teg suñ loxo ne feebar bi jeex na déedéet comme kay mu ngi am Sénégal mu ngi gën a bari kon ñun tamit waruñoo toog ñu seetaan kon lu ñu mën a def mooy ñun Gambian si mooy képp koo gis ñoo Gambia fii jógee Sénégal wa jógee feneen sa liggéey la dafa wàcc si yow pour nga call 1025 nga report ko parce que lu waa bi lu mu wax mooy ku ñëw fii dañ laa yóbbu quarantaine bi ñaari semaine si quarantaine bi su jeexee ñu test la su nekkee amuloo feebar bi ñu bàyyi la nga ñibbi parce que suñ deful loolu yow soo amee feebar bi nga dem si mbooloo mi nga jox ko ñeneen ñi kenn xamul kan nga koo jox te naka la moo soonalee kooku kenn xamul te si kaw loolu ñu ngi ñaan yëpp koo xam ne di nga gis koo xam ne dafa ñëw Gambia fii te nga xam ne mu ngi dugga fii bu yàggut report ko 1025 ñu ñëw jël ko yóbbu ko quarantaine jërëjëf.
Thank you so much, Dr. Njai. So, dear viewers, the lines will be, the number will be appearing on the screen. Please call 50500505. The lines are open and we are discussing COVID-19 in the context of our neighboring country, Senegal, where there is widespread community transmission going on. So, Dr. Desta, regarding the testing that you mentioned, what exactly is WHO planning to do with? You said the ministry was planning to do expanding this strategy. So, should people be reporting or coming frequently to the clinics, or should they call 1025 to get themselves tested? If you can just provide some clarification on that.
Yeah, actually for testing, what we need to do is actually those who have flu-like symptoms, with fever, cough, and similar illnesses like difficulty in breathing. If you have such symptoms, please call 1025. Don't go to health facility by yourself. Call 1025, and you will be advised what to do and follow the instructions. You will be guided what to do. That's the best strategy. What is happening currently is that most people, when they have such symptoms, they are not coming to and they are not calling at least 1025. So we are not doing enough testing. There are very few being tested. As a result, we cannot know exactly what's happening in the community. But for what we know, even the seasonal flu, which is not COVID-related, COVID-19 related, there is also another flu, common cold, which is happening. But even those ones are not really coming out because those are the people that needs to be tested with such symptoms, because we cannot tell the difference between the COVID-19 or the normal flu that we used to know. So it's important when you have such flu-like symptoms for you to call and get tested as soon as possible. That will be very, very useful, and the public should cooperate.
That's what they call SOCH in the Gambia. Okay, we have a caller. Hello, hello, caller.
Hello, assalamu alaikum.
Wa alaikum salam.
Ramadan Mubarak, Dr. Shamila.
Thank you very much.
Dr. Desta.
Thank you. Thank you. We can hear you.
Okay. This program is very, very important. I just wanted to contribute about the issue of the continuity of services.
Okay.
Please, please.
Very important,
You're welcome.
For RTH services, immunization services, and also for the pregnant women and the under 5. So it's very important for them to come, because if that doesn't happen, at the end of the day, we may be dealing with other outbreaks. So we are urging the public, as they are listening, come out in their numbers to continue to come for RTH services. They are still up and running, both days and outreach. as well. So we also calling on the border communities. They've been very helpful in informing the community, informing the authorities about people entering their borders.
Yes.
So we are also urging them to also advise their relatives to also stay home so that we can all be safe.
Yes.
This is a very important program. This is just what I wanted to contribute. Thank you very much.
Thank you so much for that. Thank you very, very much. Dr. Destachi,
Yes,
very important
very,
point.
very important. Thank you very much for raising that
Yeah.
that aspect of the continuity of essential services.
Yes. Yes.
COVID-19 is one of the killers, but we have many other killers. We have malaria, we have TB, we have HIV, we have many other illnesses that cause illnesses in children, women, and everybody else. So the continuity of services is very, very important. What I would like to tell you is that we have been discussing recently about how to make sure that the services are not interrupted, other services other than COVID-19. We have to deal with this new enemy, but at the same time we should not stop the services for other illnesses. So as a result, as part of the coordination structure for the COVID-19, there is a unit, a group, a team that will be focusing on essential services that are needed by the community. So we'll be doing that, and that team will be working on that. Today I think they had a meeting, the first meeting of that committee, and I think we'll be doing that continuously. But at the same time, I would like to tell you that that's why we are actually asking the community members to call 1025 rather than going to health facility, because we don't want people with possible COVID-19 similar illnesses to go and spread illnesses in those facilities. So we want to keep the normal health services that we have now to only provide the basic essential services to the general public. But those who have symptoms looking like COVID-19 should call so that they can be tested from where they are without being mixed with the other people who may have other illnesses which are not COVID-19 related. So this is one of the strategies also Gambia is following and many countries are doing to make sure that there is no mixture and we don't actually spread the illness in the healthcare settings. So this is a very good point, and it's something that Ministry of Health is also paying attention to.
Thank you so
Just
much,
to
Dr.
add on to
Desai.
that, I think when you look at our antenatal services, just to add on to what he was saying, is very important. We cannot say we have to suspend our services.
Exactly.
So if you look at our antenatal service, some of us are going back to the focused antenatal care, where we need only 4 visits just to make sure we minimize contact as much as possible. So services have to continue as well.
Yes, we have another caller. Hello, caller.
Hello, Sister Ulara.
Ulara.
Avec
Hello.
Yo, alla program alla pa contribute.
Okay, you are welcome.
Sinya jaman jaman la bring ko start ang kala program of follow abeda ba de
Amin.
Ali jaro.
Amin.
Yo ngana bana de wala ma alen tankala na bango kama de do kana ala ma ala uji.
Amin Allah.
But my concern about this lockdown na back.
Okay.
Même de ko si salo doli be je men yala ko se keno fo ko no bari se salo vende ko juma salo be nyame ndenga me na government nyanta mezo so la me yala ko bawo ko equipment no de wala men yala ko docteur e jara rol de jara docteur o fana be je la ni men yala ko se janjan no banko kanne kata jumol to ka mezo na nangamol be sala jumoro ka docteur o londo to ye mol test men be dum na se salo ke no ko ni sakela ni duala bawo monsieur mo le mon tim mantan soto weapon dem mul symbole men na me symbole soto kata be duala so ndenga no woke wonyanda kala fe nyati me yano ko government nyanda woto konjina bagala sa ko ni sungaro ko be min ko ni duma ko men be sungaro ko ne kana so wenda ya government nyata mezo sur la docteur Karola jumol men be banko kam hana manka be bari nyata jumo nangam sur la medal ko wol jumo sale ka duwal bawo wala mun dolla ci jodi ndol fuare wol so ndanga na ko kulti mi ana ka ko mara police wol be je soldier wol be je police wol be je docteur wol be je ni be la do ko wol
okay baraka ba ke ngam la ko ku mayata ba kele mais même fala woto dron comme ngam man sakunda mol ba moy kanne bare be daniro kala dron abe ko yalla dron bare nga nyuma ko e pour ka mota ka funyolo tala bon ni da hani marché wol to sambe wole ko mira kan a wasida warta ba ko mole sabati show kono iman song ngalo man sakunda ba ko jubele ba la hata ko jubele ba kala nyama baraka ba.
Maybe you can also translate.
Yeah, so I think what his call was about to look at the lockdown system of the country, to say that at least some of the mosques should be allowed to operate, because that's the only way we have to ask God, and then, you know, for forgiveness and all those things. So he's trying to emphasize so that the government can look into that. Not all the mosques, but we make sure we open certain mosques. We use the police, we use our mechanisms like hand washing, use of masks to make sure that prayers are allowed in some areas. That's what he was trying to look about.
Okay. And if you also can you please translate what he talked about in terms of continuity of care, please?
Okay. Comme kola men kena wala nyinti ka nyinin karo ke ka foko fonna loptanol to do kol men nyanta kala fol be continue ban fo mo be tla so kono so nga même foto do wala nyinti ko ni a jube loptan do kulal fanan do be je men yalla be marlin covid ko la wal do be nyita loptan to bol tarraje waya tandi ko service o mayina kuntula musol be kono malale dindingol be sasala le molbe malaria sotla molbe ele selo sotla so fo do ko nyin fay continue so wala atina na nostal ning fen ko to ngon talondi non baski ni nganda ha dindingol ka pengo men dia misal fe nsa sino la fa sanji dantanga ngana outbreak do so do me yalan ko ka fo measles outbreak cholera ni ku ko tan na finti non malla fi fana ba corona fene da dam ku kilinare ba malaria fana be tb be sasa dul fana be men yalan ko isemol mutano woto kamala mayna sila kam bulola nyokan ka fo ko colonel be kere nyindol man ta kela han wota keno ba ni ajubi hani muskon ma la jero lan to do nga kata start ka fo e ka fo me focus an ne ka nun ton kamen ken wala sinyana no nyinti so do le murka wo kam pour ka make so ka je ko service o nyin kana tinya woto kamala me mobe dan la wala pour nga ke ko mobe ni sasa data loptano wala tinna mba ke kam pour momo ya lon ko nyin sasa soto ibe toto kan ibalo ka kan ni joka kolebul ngoy kana ta loptano to ye kol ke 1025 wolbe ko mo flen be kala bawo ni ajube mi la suko no ngela sampulo ta ngata tala nyame anim be advice la men yomuta e ba ja ko ning alman tanga tina ta ko coronavirus do bawo men ta lopta ita dino na mo laji so ba na service obita kan ni mo moy problème so ye kol ke do ngana suko no ngi traje nga testing ke wala nga même foy telephone do don ye bulaw nom e ba ja ko mol men kana lopta no to ko wol ñi be talala pour ka foko ka sawni wala lopta no suñ bokki deglu kat yi comme luñ no waxtaan nek am na ko kolon di laajte ne parce que corona mu ngi ñëw ndax beneen service yi dañ war a bàyyi déedéet.
Dr. Njie, if you can just one second, we have a caller. Yes.
Right, thank you.
Hello, caller.
Hello.
Hello.
Yeah, maa ngi dégg.
Waaw jërëjëf, you are welcome.
Yeah, na nga def.
Jaama rek.
Yeah, seen boode yi man si affaire yi boode laa wax.
Waaw.
ci affaire yi boode yi def nit yaa ngi dugal no good no bad.
Waaw.
xam nga naka la ñuy def naka suñ sécurité si boode yi no. ñu mun a xam nga health bi fu nekk da nga mun a gis nit bu jógee xam nga. yooyu yëpp comme yoo leen nekk di wax diggante bi Sénégal ak Gambie ak yooyu noonu.
Waaw.
so comme suñ boode yi nekkul si sécurité bi baax nag. so yooyu rek moo nekk suñ problème nag si fu nekk ay gas la nit yaa ngi duggee Casamance yi yooyu boor yi.
Take a look.
Waaw. Fana jërëjëf sa call bi dafa important trop. What he was trying to explain is he's worried about the borders. He said the borders are not controlled, people are coming in, going out anytime they want. I think that is something that's a concern to everyone. Comme sa call bi dafa important trop, dafa am solo parce que loolu loo xam ne ñun yëpp ñu ngi ko joyantu bés bu nekk. Di nga gis ne tey soo ñu ngi ko doon waxtaan ak ministre bi waaye waxoon na ne mu ngi waxtaan ak interior ministry pour ñu seet naka la ñoo yokkee seen liggéey bi foofu border yi parce que ñun yëpp loolu lañ nekk di jooy. waaye ñu ngi ñaan communauté bi tam ñun tam dañ am liggéey foofu parce que su nekkee ne dëkk bu nekk comme Daasilaam yi noo ko waxee nii youth si nekk Daasilaam yëpp toog ne kenn du fi dugga suñu dëkk bi fii gars yi ñoo ko di patrol seen boole wala kuñ gis ne ñu delloo ko di nga gis ne beneen dëkk def loolu loolu def ñoo dimbale waaye su nekkee ne dëkk yi ñu ngi toog teg seen loxo ñu lu nekk ñu ne nguur gi loolu du dem waaye nguur gi tam ñu ngi déggal yi ñu ngi jóg di te parce que wax nañ Sénégal su amul jaama ñu duñ am jaama so loolu loo xam ne la dafa am solo trop.
Waaw mun nga continuer di beneen ligne bi affaire continuity of service.
so comme lu ñu doon waxte balaa kola bi du dugga mooy suñ service yi si lopitaan bi parce que wax nañ ne coronavirus boobu beneen feebar la waaye di nga am feebar yu mel ni comme malaria comme diabète comme high blood ñooñu yëpp am na te ndeekumba itam ñu ngi ñëw so duñ mën a toog la ñu duñ gis ñooñu déedéet loolu du mën a am parce que bëgguñoo toog ba beneen 2 3 4 years ñu stade yi am beneen outbreak bëgguñ loolu boo xam ne dina gën a garaaw comme passé corona so parce que bëgguñ loolu moo tax service yi dañu war a dem so di nga gis ne am na docteur yoo xam ne ñoo nekk si liggéey corona waaye am na ñoo xam ne ñoom ñu ngi si lopitaan bi so gis nga ku feebar rek foog nga dem si lopitaan bi ñu gis la waaye ñu ngi ñaan mbooloo mi yëpp mooy su nekkee ne da nga am feebari comme fresh cold sa yaa ngi am fever sa yaram baa ngi tànga yaa ngi am jafe-jafe si nokki comme ñu ne bul dem si lopitaan bi parce que su nekkee ne da nga am corona soo demee si lopitaan di nga ko jox ñeneen ñi so luñ bëggoon mooy toogal si kër bi rek nga call 1025 di nga gis ne suñu soo callee dinañ am luñ laa wax nga toppa yooyu noonu te dina ñëw ba sa kër ñu jël sample bi ñu dem test so su nekkee ne yow da nga am corona léegi dinañ la jël yóbbu la si treatment bi su nekkee ne amuloo dinañ la jox garab yoo war a am so da ngaa gis ne ñëpp dañu war a toppa loolu 1025 bi ñu call suñu amee benn problème.
jërëjëf Dr. Njie ñu ngi am beneen caller.
ok
hello caller.
hello.
Assalamualaikum.
Waalaikumsalam.
Dr. Njie.
Yes.
Inimbara ni tromal be.
Inimbara.
Bal konton.
Abaraka ngijo.
Ndamba jabe taybatu.
Okay, abaraka bake.
Alika Allah proda.
Okay, abaraka bake.
Allah program aku ma da bake. Because follow the Gambia medical services better than the PBJ.
Abaraka bake.
Ni doctor mo Bangkok. Because Gambia mo Bangkok di na lonko jaran lal ni na lonko Bangkok kan do baka ta kam bakele. Because ni ay courant du ni mo kuta malati.
Hade.
Dunia kono bela kuta malati. Bari courant soro da mena lonko i manke nyindi mena lonko i kodotale bari tan ko da kuta yala to. Wol be nyanda wala korosi la kaje ko kuran nana da isa longo sa dan tinya temme menga longo na lunda ya la bajaran la ka kele dol na dalo mamboro bro maria tum mamboro so non smallpox mamboro so ko mi ya ko nyamen na men jati mamboro so ko mi dolu kata ni do tum mamboro so bari doctor la ni scientist won men de dunya ko no scientist wala ka da fa boro ni be kilin nala moli be lori scientist kaje ko kuran ni wolto faale
yes
salon ti bi hani ka to fa fo man ta kula ko ne kana ko mo ni ti bi be la bari na lo dano ko ne te jarale ko no data jarale fa
hali
o mo ni de la ko ni covid-19 soto kale anata le atara boni man soto ala folo ban kato ne be kam boro si soto no ala nyame ngabula doctor no ma ya nem because don't be han kai mallala ma je ba ko mo de siar marke ko han kai
hali
lan na wali ala o sabo janni ba ko ala ne ma ya ta ci lokan wala da arjanna ni kam barin ka sunnin salon le ka anin farla to mal ni mo ta arjanna ta so na
hali
woro do kuran kana na ta tere dunya ko ni ko alin Allah mo de lola kanin ke sai ya ko mo de nyaaba mo le ko furel ba de le ya ko la ka ko ni ko ti do mo ku don to me alo ngamira ado ya ta ba ke ande ngal beten dungal beje ngani ko mo tanga do tan ya maro no ma ko si mboro panan alla be maro kuna apurani abono be soto la le
inshallah
yo bar janna do sot na ko mo do ko la ibe tan kala ngana na mbore no mala because ni mo te ko men be te muslime ya karola ni ko tan la karola ku jamal le tan do dina ko muslime ya ko men na don ko jaman so on tale bari ni kura la wajabo ka sumna na wala mo ndi mo la sianjo kan ibo bondino la nyari na kam misal kam man social distancing.
Okay.
I think he was trying to emphasize a very, very important point, yes, that this disease is something novel, it's new, and that a lot of diseases came which were new at the time, then there was no treatment at the time, and later treatments were available. So just like this one is also new, as time goes on, treatments will come. But then we need to try to make sure that we prevent ourselves by social distancing and hand washing. And he wants to emphasize that people need to understand that this is something that is real and is in country as well.
Excellent.
Yeah.
Very good.
I think he make a very good contribution as well.
Yes.
Thank you.
So I'm not sure whether maybe it's also good to translate that in Wolof, and somebody may also benefit from that. Yes.
Comme suñ bokki déglukat yi comme ku jógee kool nii rek mun noo waxtaan pour yokka su luñ nekk di wax parce que wax na ne léegi dañu war ñëpp war nañu understand ne lii feebar bu ees la wax na ne am na feebar yoo xam ne feebar boo musa dégg dafa ñëw time boo xam ne feebar bu ees la woon comme soo xoolee malaria woon amutoon faj TB di same thing HIV di same thing waaye as buñ demee rek liggéeykat yi lopitaan yi scientist yu ngee liggéey ba dem ba am garab pour loolu so wax na ne tam si kanam ji tam ni moo demee nii si kanam dina am faju so waaye si kaw loolu lu ñu war a def mooy ñun suñ boppa ñoo war a toog ñu seet naka la ñu aare suñ boppa si lii te loolu naka lañ ko mën a defee mooy social distancing ak hand washing bi loolu la nekk di emphasize te wax na ne pour ku nekk dafa war a xam ne lii loo xam ne am na parce que nit yaa ngee dee si àdduna bi yaa ngi ko gis si télé bi te foog na ne nit yi suñ naka la ñu noo dee ni si àdduna bi kenn du toog di def loolu politique loolu loo xam ne lu dëgg la te ñëpp war nañ koo xamee noonu ñu try pour ñu nekk social distancing ak ñu raxas suñ loxo incha allah.
Thank you so much. Okay, so dear viewers, we'll go for a short break and we'll be back shortly. So please get ready with your questions. We'll be coming back shortly. Thank you. Welcome back, dear viewers. So we are here talking about COVID-19 in the context of what is happening in our neighboring country, Senegal. We have here with us, like we said, Dr. Desta Tirune, the WHO country representative. So, Dr. Desta, regarding the treatment for COVID-19, we all know there is no definitive treatment for it. So, what exactly is available for people in the treatment centers, and why is it that when we have it, we have to come to the health facility if there is no treatment?
Yeah, that's very good question. And although we don't have any specific treatment for COVID-19 for now, we may get it in the future, we don't know. But for now, we don't have a definitive treatment, meaning that we cannot cure with some medicine the disease. The virus cannot be killed with any medicine. But at the same time, the person who is sick with COVID-19 have lots of symptoms that are very difficult to actually manage by the patient himself at home. They may have, for example, high-grade fever, may have difficulty in breathing, may have problems related to the kidney, related to the lungs, to heart, all these issues that are associated with the illness, but that need medical support. You can only do it in medical facilities. That's why, although there is no specific treatment that can cure it, but associated illnesses that are manifesting during the illness can be treated. And by doing that, we can improve the survival of the person who is affected by COVID-19. That's why we are saying we have to still report and admit them to a treatment facility to provide them with this such care. And sometimes also a case that looks mild, after a few days may also progress into a very complicated illness that may need sophisticated life support mechanisms like dialysis, like breathing support. All these things can only be done in hospital settings, and that's why we are preparing treatment facilities separately for such cases, so that they don't die as a result of these other symptoms that are manifested because of COVID-19. If we can manage that, they can survive, and the treatment, the illness can be self-limited, and after that they can recover by themselves with their own immunity. So that's why the treatment is organized in such a way.
Thank you so much for that clarification. And Dr. Njai himself, he's working in the treatment center. We are so proud of the work he's doing.
Thank you. Yes. So kam memem fo kam do wala yañi ninka munem jaraloti ba on ka moy sate ko ne ka fo ni jaralti ye munat na mol kata jaral lato wato wat. So nka memem kacha ka woto wala nyinti ko boro man so do me alon ko e ka fo ko wala benyi sasa nyi bondile baloko. Bala ka men sabu balo kono boro sota men ka bonni la ni tay ko ngole kedi boro bu jeme ko ni mo bondira nata balol kanta boro bu jeme bala kando bon nata ni jokkale atebul ise fonyo fanan dino
sorry to interrupt, we have a caller it seems.
Right, no
we'll
problem.
Come back. Hello caller.
Hello.
Good
evening.
Good evening.
Good evening.
Yes, I can hear you. Good evening.
Good evening.
Good evening.
Okay, my concern is regarding the coronavirus. If you look at it, the number of cases that is carried out throughout this country, I think if you look at it, the number is still less than 500 as of today. I don't know how it is. So that we can do rapid testing, at least massive testing across the country, so that's how we can know exactly our stand. So we can know exactly those who are positive or those who are not.
I think that's a very important thing.
Yes.
Yeah,
Yes.
Okay.
Yeah.
So, like we are saying, like if you look at the testing now, it's trying to be expanding. Which we're doing that. Anybody who calls 1025, we make sure sample is collected. Also, anybody who feels like you need to be tested, you can always come up. I think that is something that we really looking at, and then a lot of people are willing to come out. But I think one of the problems we have is the stigma. A lot of people don't want to come out nowadays about the for testing, I think.
Yeah, yeah. Just to add, the Ministry of Health is strategizing on how to expand the services to the public so that people can have access to testing facilities. And one of the plan is actually to open more sites where people can go and get actually samples also taken from patients that show symptoms like symptoms of fever, cough, difficulty in breathing, headache.
Symptoms of fresh cold, that's what they call it.
Just
like
like
fresh cold.
Yeah, like cold symptoms, yeah. Related to like what you get, when you get seasonal flu. Similar illness, similar manifestations at the initial stage. But eventually, as time goes on, it may get complicated. But these are the initial symptoms. When you get that, then this treatment facility, the testing or specimen collection sites will be collecting specimen from such patients, and more people will be tested. So that there is a plan already. That has been, a concern that was raised by the caller is very correct and accurate. And we are not testing enough, and many people are not coming forward for getting tested. But what we appeal is those of you who have symptoms that look like flu, please call 1025 and explain what you are feeling, and then you will be advised what to do, and you will be directed where to go or where to stay.
There's
and then
caller.
usually the people will come and take
Collect
sample
sample,
for specimen from where you are.
There's a caller. Hello, caller.
Hello, assalamu alaikum.
Walaikum salam.
Yes, sir.
Mala ure.
Okay.
Mala ure.
Wow,
Okay.
wow, deng la dega.
This is coronavirus in Laguna, student lana.
Okay.
Wow.
Student lana from now.
Okay.
Wow, the Mapuana when the coronavirus in the You have many assistant exams in grade 9.
Wow.
Okay.
Okay.
I think it was a student calling
Yes.
about their concern for those of them who need to do exam.
They are grade 9 exams. I think I'm sure the Ministry of Education is looking at something
Yes,
for
yeah,
them.
yeah.
Yeah. Maybe you can just.
Yes, everybody have to understand that this is something that is,
Yes.
everybody is losing at this moment worldwide. Everybody is in trouble, so we just have to abide by it and see what happens.
Yes,
next.
but the Ministry is also of
doing
Education.
something.
I know they are doing very well. They are making sure that most of this thing is going online, and either online or on
TV
using TV or radio, so that children don't really miss. It's not the same as classroom physical presence, but still,
it's a choice that you have to make, in times of difficulty. If it was a war setting, for example, nobody will ask to come out and to get tested.
School, exactly.
It's similar to that, The difference is that we don't have an army which is holding a gun, but this one is a hidden army that will be just moving around and killing people around.
That's true.
So we don't want people to die because of this illness that can pass. And if we just tolerate and bear with what the government is doing for some time, we'll be over it. But whatever comes with it, we can handle it the way we should handle it without putting people at risk.
Yes.
So that's the purpose. Government wants to protect people, and I think Ministry of Education is also planning something that will be appropriate for the current situation. But don't be bothered about not sitting for exam as you used to do before, because it's a choice between life and death. We would like always choose to live,
Yes.
and then survive, and then this day will pass,
Yes,
and the
inshallah.
exams will be done. I think
Yes.
government is thinking about it. I'm sure, but
Yes.
I don't have the specific details.
Yes, yes, yes. Thank you so much. So Dr. Njai, I think you can translate
to translation.
Yes, please.
So comme memang foka wala jaral bul na nyinti ba mol ba fala ko ni jaral ti yow mo na mol kata jaral lado ngo jaral man sota la bari me alon ka problem men ko si bala ko ka jaral non naka kundi mo ko kundi mboro sota naka baladi mo ko baladi mboro sota naka fono ka pala fono mboro sota naka ni jokolandi bu se fonyo fana dino la so mo nak nanka mol fana sama jaral la wala nyinti ko sa sa ni mu fenete me alon ko a ila balwo nya se falino le tarin kono anu nuwa kadete be suwo kono ase mantoro dino la wala tan ke samba jala la pour kan hakilo tudo ni misal falinto kadete balwo kono to isa yan saje juna nze mako no ba ba la dolbi je e se sula no falla bon la me alon ko e be sula la pour ka fonyo di la ni man fonyo di le se fanon wala ni man pengo dol de wala man boro dol de se fanon ro kamala wala tan ka mol samba pour ka e samba nyin jala lato mbe sa kalam to nyama ko sa sal sotta jan men yalon ko man jala lo soto non kutake membe ko HIV pare sa kata nu nyame fala bona mol ka fa sa ta kurango ba jaru na ta sotala sainte to mbe sa lo wonyam suñ mbokki deglu kati comme niñ ko do waxtane moy ñu bari ñu ngi wax ne su nekké ne amut fajj kon naka la luta ñu day yobbu nit yi ci l'hôpital bi pour fajj leen luñ da wax fofu moy ne amuñ garab bo xamne moy fajj virus bi waye am nañ garab yo xamne ñoo la dimbalé parce que su nekké ya nga am bopam médi am nañ garab buñ la jox pour bopam médi génn su nekkee sa yaram baa ngi tàng am nañ garab boo xam ne dina génne yaram mu tàngam su nekkee yaa nga woccu di same thing so dafa am ñoo xam ne tam léegi-léegi fo nga soxla ngelaw parce que luy xew mooy feebar bi dafa nekkal loo xam ne mën ngaa toog rek sa condition du change so su nekkee ne yaa ngi si kër bi te loolu xew amuloo dimbale foofu mën ngaa ñàkk sa bakkan loolu moo tax ñu leen day yóbbu foofu su nekkee ne ku am yeneen problème ñu solve loolu su nekkee ne di nga dem sa condition bi change yaa ngi soxla ngelaw yaa ngi soxla yeneen yi nga am ko si lopitaan parce que yooyu doo ko mën am si kër bi so loolu la te sa sant yàlla ñuñ am yëpp dem nañ ci treatment center bi te génne nañ foofu ci jaama kon ngeen ñaan rek yàlla loolu yokku rek
amin jërëjëf Dr. Njai. So Dr. Desta, I think similarly also to quarantine, what really happens in the quarantine facility? Why is it that people can't go in? You know, there's a and people when they are either a suspected case or when they have traveled somewhere, they are taken there. But we'll come back to this question. Let's just take this. There's a caller. Hello, caller.
Hello, sister.
Jamarek.
I'm coming in URR area.
Yes.
So security board ni ananda je consider because every day mo ga dunde ga funde. So I know abe bele la tangola every day mo ga dunde ka na gara sota ka mo nan ga me ko. Yeah, so and then security ananda je consider. Oh, every day mo ga dunde Senegal de mo nan ga me every day mo.
Yeah. So mu fenne de me alon ko ela kolo ñu kumata baake bal fenne me alon ko dol bebe wol fokan kabrin kunun ko ko mol kadu na Senegal lu wolu ngamna security ba moy kan comme nga fa ñame ministre ni la ministre be diamo kan pour ka jube be bodal ñi bambandi la ñaadi pour mol seda hawa sifa way ko nga fa ñame don do fanana do ko le banku dingol ni nga momo je kata wala nga balang ni nga momo je kana nga balang ñanta kelentul be la do ko de pour kan na banko tanka. Yes.
I think it's a similar concern with
the so it's
yeah.
Similar concern with the borders that in URR
yeah.
Almost every day people are going in and out to get ice block from Senegal. It's something that's a concern and the security forces need to take that note.
Yeah, one thing I want to say about
oh, sorry Dr. Desta, we have another caller. Hello, caller. Hello.
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 Wa naende.
Jamarek.
Dama bëgg a contribuer programme bi.
Ok, dalal nañ la.
Alhamdulillah. waaw ma ne. waaw comme coronavirus bi nu ñëwee nii.
waaw.
comme naa ne tamit very good advantage la pour ñun tamit suñu docteur si ñu jéem a am benn investigation bu ñoo def pour jéem a seet ndax dinañ mën a defar yeneen garab yi fii suñu biir dëkk.
waaw.
ñu boole comme local medicine si ak garab yi tubaab yi. foog naa suñ ko boolee foog naa suñu àndoon ci loolu sax mun naa am garab bi Gambie bi mun nañ ko fay amee. waaw man daal am naa góom-góom boobu noonu tey tamit ba tey government mi tamit ak nit ñi nga borom xam-xam yi nga xam ne ñoo nekk ci Gambie bi. nañ jàppalante ci garab bi because luy independent mooy lépp lu nga xam ne ni yaa ngi ko soxla nga defaree ko sore waaye everything léegi su fekkee da nga ko war a jëlee ci bitim réew tamit dañoo gën a dellu ci ginnaaw rek everything su nekk ci ginnaaw dañoo dellu rek.
waaw dëgg la.
Thank you very much. maa ngi doon woote Farafenni fii.
ok jërëjëf fa naa sa call bi dafa am solo trop comme ni nga ko waxee rek pandémique bu nekk su amee da ngaa gis ne research mu ngi dem te ñun tam ñu ngi try pour dugga si research bi ñu seet naka la ñoo def waaye comme noo ko waxee Gambia tam ñu ngi try parce que soo gisee pharmacie association bi ñu ngi defal suñu own sanitizer si dëkk bi léegi fu ñu nekk nii so loolu loo xam ne dafa am solo trop ñun tam nañ try ñu seet naka la ñoo def jërëjëf sa call bi.
So he was asking that, you know, we should try to find a cure for this within the country, for the virus, using local traditional medicine and also the modern medicine to mix it. Maybe we'll find a cure, he said, within the country. So to which Dr. Njai said, well, we are doing some things, but we are doing mostly in the sanitizers and other things, and the research is ongoing.
Yeah.
Yes.
Okay. Yeah, research, you know, anything that you use for treatment of people has to be reviewed and evaluated so that it doesn't bring also other harm. And the efficacy, also the effectiveness of the medication that you get has to be there are several stages that you have to go through for human safety. And that's a protocol that you have to follow, whether it's in country or outside. There is a protocol that we have to follow. That's why, you know, usually it takes time. But there are many medicines that are being tested globally, and the world is working, and even vaccines. There is a lot of trial going on, and the world is doing a lot. But in country also there could be some studies that will be going on.
Okay. So Dr. let's quickly, because we don't have much time, I just want us to just
the quarantine,
the quarantine, please.
The quarantine, yeah. Where do people go to quarantine? Yeah, that's very important. People will be worried about, you know, why are they going there?
Yeah.
The quarantine means that you are separating people who may have been exposed to the infection and may not be showing currently any symptom. You separate them from their families and from the community. You keep them for 14 days. Within 14 days, why 14 days? Because within 14 days, if they are infected, they will show the symptoms of COVID-19. If they show the symptoms, they will be tested. Even if they don't show the symptoms, before they are released, they will be tested. If they are negative, they will go back to the community. It's just to protect the community, because from what we know from other countries, any person who is infected can transmit to up to 9 people at one time if they are not separated from other people. So that's what is happening. It's just to contain the spread of the illness. And for that also government has put also facilities for that. Accommodation will be provided, food and all necessary necessities will be also provided in those facilities. That's what government is doing. And this is for only 14 days. Once you finish the 14 days, you'll be tested and you'll be released. It's good for your family, it's good for your immediate relatives and contacts, and it's good for stopping also the transmission. That's why it's done. It's a lot of cost for government, but it's done because this will help us to stop the transmission in the Gambia as soon as possible. That's why, you know, it's done. It's not just to deny people access to any other services. It's just because it will benefit the population, the good purpose for the larger community. That's why it's done.
Thank you so much for that clear explanation. Maybe if you can quickly translate, because we are running out of time.
Comme même faut ko walen quarantine alba mo ni mo na de ka fo ye sambale ye ma bo fo tiltande nan nga même fo to wala nyinti ko munat ni ka mol sambaje wala nyinti e botan dal to me yalon ko fo ye sa so fe ma so don tol malo isna no ne nin sa na defo malo so wala nan ke samboro pour kana sawni mola parce que nga même fo to ni te ya sawni mola asko na me de batande bala stado batandi no do se fo no aniol andu nga je ko mo ni aso do stano fo mo konon to na te de sa ila mol bala men be bala se mo konon to be di non oto kamma wala nan ke sambaji andu ni ajube quarantine fana ngata phénomène ka man sa kunda ko jama balta bawe be hotel lu wasle e be bon dilele e be domoro dilele be jol dilele fo be dile won fenne de me alon ko tapan social man sa kunda kam bak bala jarta la le pour ka je ko e kana mol sasandi bango kan wala ma anafati suñ bokk déglu kat yi comme lu ñu waxtaane mooy affaire ko quarantine bi lu tax ñu dee yóbbu nit yi quarantine mooy ne parce que yaa ngi ñëw xamuñ ndax yow yaa ngi am feebar bi ndax amuloo ko te bu nga jox ko ñeneen ñi moo tax ñu ne dee yóbbu quarantine te suñ la fa yóbbee soo ko xoolee tamit te nga gis ne loolu dépense bi seer na trop si kaw nguur gi parce que dañoo luwaas hôtel yi ñu ngi leen a jox lekka ñu ngi leen a jox ndox waaye loolu yëpp jar na ko parce que bëgguñ nga jox ko ñeneen ñi parce que yow di nga ko am yow feebarloo soonalut la waaye di nga ko jox keneen mu soonal ko wala mu ree ko so loolu moo tax nguur gi di def loolu waaye nekkul ne comme dañ la bëgg a tëj foofu wala leneen parce que ñu ngi ko def si njëriñu dëkk bi yëpp loolu moo tax ñu ko dee def.
I think you can beat them by.
Okay.
On your side.
Thank you very much. Between bako lamor lal ba wato fela bantanang mal be tentula mbal jaira alla programme no mola ningala sonda minala kota ke dimaso nale kacha ala baraka bake.
Thank you. And from your side also, Dr. Desta, what's your final words to our viewers?
Yeah, just don't relax, don't worry, but be careful. Do follow the instructions that are given by Ministry of Health. Keep your distance always, wash your hands, don't touch your face, meaning eyes, nose, mouth. And if you do this, I think you will be protected and you will protect your family. And keep safe.
Thank you so much, Dr. Desta. So, dear viewers, we have come to the end of the program. So, like we said, we have widespread community transmission in Senegal. They're reporting a lot of cases every day. And that means we have to be extra vigilant, even though we don't have many cases in the Gambia. But in fact, it means that now is even the time to even step up everything we are doing and be really very aggressive with the preventive measures that Dr. Desta has said. Please, dear viewers, if you have any symptoms of flu, fresh cold, if you feel like you are having, you're getting ill with cough, shortness, difficulty in breathing, please, 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 please call 1025. Stay at home and call 1025. Thank you so much, dear viewers. Stay safe until another time. And to our crew, thank you so much for all this work you're doing for us. Thank you so much.